You're listening to Healthcare Now Radio. Stand by for This Just In, the latest in healthcare innovation and technology trends with your HIT advisor, Justin Barnes.
Thank you for tuning in and welcome to This Just In. I'm your host, Justin Barnes. In these half-hour segments, I'll bring you the latest advancements in healthcare, strategy, innovation, and public policy. As always, we're broadcasting from the This Just In studios on the Business Radio X network as well as the Healthcare Now radio network. For this episode, my 152nd episode, we have a special guest, Dr. Brian Hill, co-founder and chief medical officer of HIPnation. Welcome to the show, my friend.
Thanks, Justin. It's a joy to be here with you.
I came across HIPnation, I guess, probably 3 or 4 months ago, at least 4 months ago, and a good friend of ours, Ross Mason, a great man here in Atlanta, Georgia, just wanted to connect us, felt that we would get along very well, and he knew that you had a fast-growing business, and he said, this is just something that should be in my purview. I might be able to assist you guys at some point as well, and so he put us together, and it really was a match. So I just thoroughly enjoyed getting to know your organization and getting to know you and the whole team personally. So thank you for that. It's just been a true pleasure to get to know you.
I'll tell you, Justin, that goes both ways. We feel very blessed to have crossed your path, and your passion and your excitement for doing great things is contagious to us as well.
Well, and it's kind of interesting because we do have a lot, certainly you and I have a lot in common. We did a lot across the industry, but we never crossed paths until now, which is, timing is everything, which is great. But we both did a lot of work, and I don't want to get ahead of the show, but are on Capitol Hill and around the country and a lot of speaking. So it is interesting that we had not crossed paths, but here we are, and I'm excited for this show. And I just want to cue up the audience. I'm really passionate about this model and what you guys are doing. And I think even off air here, we were talking a little bit, and I said, HIPnation is deploying the very first strategy that I've come across, and I would not have believed it if I didn't understand the mechanics and dove in deeply to it, that actually you can lower healthcare costs. Again, all my work over the last 20 years has been, all I want to do is stabilize the rate of healthcare costs, the growth of healthcare costs. I never thought we could actually reduce them, but I just want to reduce the rate that they're growing. That's all I want to do. But now with HIPnation, I really do believe the way you guys are deploying services, and I won't get too far into the show, but you guys are just providing a phenomenal product in healthcare, and I really do see, because I actually went through the mechanics even in detail today of how you can actually lower healthcare costs. So congratulations, my friend. I look forward to the show greatly.
No, thanks. Glad to do as well.
So tell us a little bit about you before we dive into HIPnation and what you guys are doing and kind of conquering the community in the world. Tell us about your background, where'd you grow up, go to school, all that good stuff, Dr. Hill.
Yeah, sure. We'll go into the Wayback Machine maybe. So my pathology comes because I'm one of 15 kids. So maybe that explains a lot of what drives me. Grew up with a mother who was a social worker at heart and found the way to reach the world is to try to bring people and adopt children. So I grew up in a large family, and I think that set the foundation of who I am as an individual. I'm a practicing physician. I'm one of those people who always knew I wanted to be a physician since I was a young child. And so I pursued that interest and went to medical school at the Medical College of Virginia and decided to pursue a surgical pathway. So I attained my residency at the University of Maryland Medical System in urology. And I've been practicing since 2004 here in Atlanta. And during that entire time of walking through life, I always kept that goal at the forefront of my mind that medicine is supposed to be a way to get out into the world and love and care for people and to try to make other people's lives better. And it was that wonderful calling of medicine that excited me to follow this path.
Wow, excellent. So how did that integrate into creating, tell us about HIPnation and where did the concept come from and how did your background really integrate into the formation of HIPnation?
Yeah, so medicine's beautiful. I generally tell patients and people that come across my path that I feel bad that they're not a physician because I think it's the best job in the world. And the reality that you oftentimes unfortunately find in medicine nowadays, and I found this when I came out of residency, is that people go into medicine to try to help care for others, to try to provide this great service of healthcare to people. And the difficulty became when people come out of the residency is they start realizing that the healthcare system is not necessarily structured to provide the best care for people. Physicians get distracted. They're pulled in multiple different ways. They're third-party payers. There's a mix in this healthcare industry that isn't necessarily focused on providing great care for patients. And physicians are caught into this model of healthcare delivery that isn't necessarily patient-centric. Mm-hmm. And so if you're really a physician that was called to go and care and love people, and you come out and try to practice in this system, you start realizing pretty quickly that we're distracted. And so it was that understanding and realization of the distraction that the system brought made me get into the figuring out why. And so the foundation of medicine is very simple. Medicine is we look for symptoms, and we take those symptoms, evaluate the symptoms to try to find the disease. And the symptoms in healthcare are the three-legged stool: cost, quality, and access. Those are the three issues that we see in healthcare. Mm-hmm. And if we start trying to dive into the diagnostics of figuring out why is cost a problem, why is the quality and disparity of care issues, why is access an issue, if you dip below the surface and try to figure out the why, then you can start figuring out how you fix it. And that's what medicine is all about, is finding out the why in order to fix the disease, not just manage the symptoms.
No, very true. So, and you really saw when you were out there, I guess, on Capitol Hill and testifying and moving through the industry, you really found people that felt the same way you did, right?
I did. And so, out of that love and desire to find a way to fix medicine, it really drove me to learn, to take all of the time that I had now available coming out of residency to get into the understanding of the economics of healthcare. I've always been interested in policy. I've been always interested in trying to find a way to fix things. And so when I came to that realization as a young physician that the healthcare system wasn't structured for our patients and that there were issues, I wanted to start learning and reading. I started traveling and talking about health economics and healthcare modeling. I spoke from the understanding of the economics of the exam room and the uniqueness of that perspective of healthcare happens in the physician's office, and how do we fix that economic model of the delivery room. And so that gave me just the ability to go out and really kind of intersect with interesting people, whether it was in the think tank space, whether it was on the speakers circuit, whether it was going and talking in DC, whether it was talking at the state capitol of how do we fix things. And along the way, I've been able to meet some really interesting and unique people that help round out my understanding of healthcare, not just from the exam room, but even from that 30,000 foot level. So I think what we do is we end up taking and putting both things together. The understanding of the economics in the exam room, plus what is the system and the issues within the system, and how do we make that work together?
Yeah, I met some of your partners, your co-founders, and they had the same passion as you. And what's really just wonderful about you guys is you can change healthcare. You know the inner workings, and certainly when you know the economics, the clinical component, and you merge these, and then at that point you can reduce costs for individuals. I think your focus is small businesses, but and individuals, but the fact that you know this and that you're achieving this is just phenomenal. So and your team, again, your co-founders are pretty amazing too, and the doctors that kind of came along. And I do want to dive into that a little bit. So tell us, I guess, something about your physician co-founders, because that's really where their network is fairly large across the country as well. They have a bead on healthcare, and they have a bead on wanting to change healthcare. So talk a second about that.
No, that's correct. We have a passion for fixing healthcare, and that passion drives from being physicians. So my co-founders we have two fellow physicians as co-founders, Dr. Hal Schurz. Hal Schurz has developed an organization called Doctors for Patient Care. It's a national organization that has been focused upon one thing and one thing only. How do we actually put patients and physicians back at the center of healthcare? So they've been created a national foundation to do that. They have physicians throughout the 50 states that are engaged and involved with Doctors for Patient Care. And it right now is the one functioning physician think tank based upon active practicing physicians. So he's one of the founders. Dr. Jeff English is another one of our founders, somebody that's been traveling and talking about health economics, as well for the past decade. He's written a book on health economics. So he's one of our founding fathers. And then we also have Davis Butler, who is equally passionate. He's a healthcare attorney, has worked through the IOC as well. And his passion is as equal as ours. And how do we help remodel the healthcare system in order to make it meet the needs of our patients and the physicians who serve those patients.
Yeah, Davis is unique, and getting to know all your partners are fantastic, and just getting to know Davis a little bit, and just knowing what he has to do on a daily basis and the years he's put into building the framework for you guys to be able to navigate. Just navigating the laws, federal, state, is just insurmountable, and he's done it though. I mean, it's pretty amazing. So I want you to talk about some of the packages that you guys offer, or this really the service offering, because what I love about it, I don't know all the clinical aspects. So you can talk about that, but I got really passionate when Ross first told me, for $100 a month, that you can offer a comprehensive primary care package, and then you can wrap around all the catastrophic stuff that you would want. But for $100 a month, and really all in with all the catastrophic, it's like $260 or $280. You have comprehensive care, much greater than anything that exists out there today, with your doctors, and you put the whole IT platform in there as well. That is a lifesaver for small business. I think I almost approach everything through economics and taxes, and how can we create a better sustainable infrastructure for this country, and knowing how much money is going out the door, but we've got to look to see where we can reduce costs. And the biggest area that we're bleeding is healthcare. And so when I heard about this concept that you can save businesses and individuals 50% off their healthcare costs, I just got excited. So talk about what's behind that. What is the service package? I just covered it at a high level, but from a clinical perspective, talk about that and why it's superior.
Yeah, it's interesting. The common response we get when we talk to people about this is just too good to be true. It just can't be true. And the wonderful reality of it is that it is true. And the simple economics behind it is that there is a third-party payer mix in healthcare right now, which is the insurance industry or the federal government, that is engaged in every aspect of healthcare. And that engagement of that third-party payer in healthcare is when you see your doctor, not the insurance you pay. When that third-party payer interacts with healthcare, it adds about $600,000 per doctor in healthcare on an annual basis. That's $600 billion a year in the healthcare system that has nothing to do with healthcare.
Right.
And so if we take that idea of insurance and say it's a necessary thing, but we move it aside because that's necessary not for the cough and the cold, but it's necessary for the heart attack or the stroke, and we put healthcare back towards, okay, how do we now have our patients intersect with our physicians? And by removing insurance, if we take $100, and you said as a membership fee, that $100 allows patients to have 100% access to a primary care doctor that only manages 700 people as opposed to 3,000 people, and gives great and tremendous healthcare focused now on the individual. And so that is majority of care, 60% of healthcare happens in the primary care space. And so we take that and make that a very robust foundation of our healthcare model. And so that, by making the focus of healthcare on the individual and getting rid of the cost in that space, drive down the cost of care. And we've done that same idea in the outpatient space. So everything in the outpatient space is also an inflated price because of that intersection of insurance and healthcare. And again, if we remove that intersection of insurance out of healthcare, the price of healthcare drops drastically. And so we can do that and drop the price of healthcare 30, 40, 50% in anything in the outpatient space, and sometimes as much as 80%. Labs and imaging, consults with specialists. If we get insurance out of that space, the price drops drastically. And so therefore, we are providing great healthcare focused on the individual. And now, since healthcare is cheaper, insurance is just a reflection of the cost of healthcare. The premiums pay for the healthcare. Now your premiums of insurance start dropping as well because the cost of healthcare is cheaper. And then you can take that insurance and apply it in the space where it's supposed to be. If you have a heart attack, if you have a stroke, if they have one of those rare catastrophic events. So you take that great insurance product now that is a lower cost product, tie it into a low cost, high quality, accessible healthcare product that's focused on the patient. And now you've created a great solution for individuals, for small businesses, radically reduced costs, great care, convenient care that people have never had before. It is just a remarkable way to do what we were called to do in medicine. Just go take care of people.
Yeah, no, I love that. And when we talk, I love when you say that. It's just, that's what we want to do. We want to take care of people. We want to serve our community. And I can see it in your heart. And it's kind of cool. I was prepping for this show and I talked to your other partner, Will Hall, the CEO of HIPnation. And we really went through the economics. I really wanted to make sure that I understood them. And he said exactly that. Once you start taking when you start looking at the costs, and you can actually reduce costs by, for lab tests by 40, 50, 60%, and you start basically doing, some of the cash pay aspects of it, that's where you really do begin to, you save a lot of money. I think the other example that you've given, which really resonated with me, and I think this will resonate with my audience, is think about automobile insurance. If we wrapped in our tires, our gas, everything like that, that is why we would be paying, $3,000 a month for our car insurance. But we don't. We probably pay $100 to $200 to $300 a month, depending on what kind of car you have and the value of that car. Well, insurance, we insure, to your point, we insure everything. This is a really good example, because if you don't insure that primary care visit and you take out those lab tests and you just pay for those on the side, you can save 50, 60% of your healthcare costs, 70%. And that's what we're doing. And that's the model that you guys have done. And I love using that automobile example, because people understand, yeah, if I wrapped in my tires and I wrapped in everything, my gas, you'd be paying a fortune for that every single month, because also you have to spread it out, and you have to, that's when the actuaries get involved and say, oh, they got to pay a little bit more, that community, all that kind of stuff, your rates would go through the roof. So.
No, you're exactly right. I mean, and all that addition of all those intermediaries in there make the overhead cost of an average primary care physician's office run 60 to 70%. Yeah. I mean, imagine if you're a small business listening to this and you're running overhead costs of 60 or 70%, that means that you've got to really drive up the price of the product that you're selling. Yeah. And that's what healthcare is. So if we take out all those administrative costs, if we take those 5 people in the back office of a primary care out, and those now are not having to be paid for through higher healthcare costs, now the cost of healthcare drops drastically. And that's the beauty of what we're doing. And not only does it drop the cost, I'm a quality guy. We're a three-legged stool, cost, quality, access, right? So now the quality goes through the roof, because now your primary care doctor focuses exclusively upon the patient sitting in front of them. They're not having to follow the requirements or metrics that come from a third-party payer in order to make sure that they get paid. Now it's just a matter of, how do I meet your needs as a patient in front of me to the best of my abilities, as a relationship to improve your health and your wellness. And that dramatically changes that physician office and that physician visit. And that's what really excites me as a doctor, is that, like I said, our doctors get to be doctors again. How cool is that?
Yeah. No, I agree. And the way I also simply explain it, even to myself, when I was trying to get my head around it, this is proactive care instead of reactive care. For example, you're Dr. Herrera, which actually I'm now a customer of HIPnation. I went and purchased the service myself because I just love it. And I know your doctors are great. I've actually known Dr. Herrera for 20 years, but he checks in with me on a regular basis to make sure that I'm taking my medication that I'm supposed to be taking. I love the primary care doctor that I had to get rid of when I switched to the HIPnation model. I loved him, but I never heard from him. He never checked to see if I'm taking my medications. He doesn't see if I'm looking for refills, nothing. And he's a great doctor, great bedside manner. And you'd say, oh, I love him, he's fantastic. And I do, but the level of care and service is not there, unfortunately. But with Dr. Herrera, that I want to switch to HIPnation, it is. And so it's just fantastic. And so that's the difference. And everybody that I talk to knows this is the direction healthcare is going. This is going to shift over the next couple of years, certainly as direct primary care picks up. And so let's transition to segment, because how has the physician and care provider community received HIPnation so far? Because you're disruptive. You're disruptive here in Atlanta, where you guys have started. I know that you can move to other cities very quickly, but because of the network that you guys have. But how has our communities received you guys and received HIPnation?
Well, it's been remarkable, and we are expanding rapidly as a result of that. We're expanding rapidly as word of mouth from physicians. So the difficult part of medicine right now is that physicians are burnt out. If you look at a recent study, they found that 61% of physicians are burnt out in medicine. And they're not burnt out from taking care of patients, right? They went into medicine to care for patients. They're burnt out because medicine is not relational anymore. Medicine is now about checking the boxes on the computer, making sure your note is a 7-page note that's a standalone billing document. It's not about providing great care. And so when you have a group of physicians that are burnt out, they can't provide great care. They're not doing what they were called to do. And when we sit down and I see what we've done with HIPnation as a platform, we give these doctors, like Dr. Herrera, who was saying he's a great doctor, but he's going, I just can't be a doctor in a system. I'm just having to move people through in a rapid pace. I can't have a relationship with them. When we give them a platform to step out, and say, you don't have to worry about coding, you don't have to worry about billing, you don't have to worry about meeting insurance regulatory requirements. You just go be a great doctor, and you do exactly what he's done, Justin. You reach out and have conversations with your patients. You create a relationship. You help drive medication adherence. You make sure that you're following up with your patients if you had a conversation about weight loss or exercise, because relationships change people's lives. And when our physicians see that, and the ones that are engaged with this are remarkable physicians, they go tell other physicians. And so now I've got 5 doctors that have reached out to me within the past week that want to participate with us. We're having specialty groups that are reaching out going, I want to participate in what you guys are doing, because they realize that we are giving a platform for doctors to be doctors again and provide great care at good cost for our patients. And again, that's what medicine is.
Yeah, no, I love it. And for those joining us a little late, my guest today is Dr. Brian Hill, co-founder and chief medical officer of HIPnation. So obviously, and I've seen this reception. I've seen these doctors, joining your network. How large are you guys right now? Just so I know.
Yeah, no, it's great. We've got 9 primary care physicians. We'll be adding a 10th on the first week in July. We are in 9 different offices once we add that 10th physician. Mm-hmm. We're in the metro Atlanta area. We extend from the Decula down to Tyrone, Georgia, and everywhere in between. And we're
what, 4 to 6 million people? That's what you service. 4 to 6 million people. Yep. You guys can serve. That's great.
We have a great bandwidth of patients and members that we can bring on board. And we're expanding now. We're reaching out into Athens. We've had physicians actually that are ecstatic in Athens that are going, let me help you expand it here in Athens. We're doing the same in Macon. Again, doctors want to do something different because they realize that healthcare is not working like it's supposed to. And so our growth has been remarkable. But our focus right now, Metro Atlanta, let's provide great care to the people here in Metro Atlanta, and then make sure that we take that great care, that model that we've built, and put it into other places throughout the United States that just need great care.
So let's just briefly talk about that, because obviously my listeners are all over the United States, actually all over the world, very fortunate. But tell me about, where do you guys plan to go? Expanding throughout Georgia probably the next 9 or so months, 12 months. But what states after Georgia and or cities do you think HIPnation will go to?
Sure. So we're looking at Texas. So we're looking to be in Texas by the mid of next year. Mm-hmm. We're looking at Houston and Dallas, Texas. We have some physicians there that have been hollering at us since we developed this concept about 18 months ago that want us to set up shops there. And then we're looking to spread through the Southeast to Alabama, to Tennessee. There are next 2 drop spots. And then we just want to start moving up through South Carolina, North Carolina, and then start moving west as well. We call ourselves HIPnation for a reason, that we plan on taking our innovative delivery model, disrupting healthcare across the nation in order to bring better, lower cost healthcare to everyone. This is how healthcare should be. And we think that this needs to be everywhere.
That's awesome. What do you hope to accomplish with this venture?
Great. 2 things. I went into medicine because I love medicine, and I'll tell you, I think you know this, Justin. I've taken myself out of medicine about 80%. I spend a day a week in my clinic now because I just have to be in that exam room because I love being in the exam room. But what I need to accomplish, and the reason I'm doing this, is because that love of medicine has driven me to realize that when 6% of my fellow docs are saying that they're miserable in medicine, when doctors are telling their kids to not go into medicine, then that means we need to fix medicine, because 2 people are struggling as a result. Mm-hmm. Our patients, because they're not getting the quality of care they need. Our patients are paying tremendously high costs in order to access a healthcare system that's not working for them. And our physicians are equally miserable trying to work within this system. So I want to create a system that fixes the problem for both of those 2 people. Great care for our patients, provided by physicians who are happy to be able to do what they're supposed to do, provide that great care.
Love it. That's fantastic. One quick question, because we're going to close here in about a minute. I always like to ask my guests this question in closing, because I know that you guys do a lot. Your family is an amazing blessing to this planet, not just to your company in our community, but to the planet. Where do you invest your time, talent, and treasure, and why? In 45 seconds.
45 seconds. Church. Our church family. My wife and I are actively engaged in our church. My wife teaches Bible study at our church. We want to participate with our church because our church makes great impacts in the community here locally and nationally. And so our heart is in and with our church. So when we're working and struggling and fighting to make HIPnation this tremendous, wonderful product that we're excited about. The rest of our energy is spent with our church members and growing that family.
Excellent. Here's a 30-second here's a question with a 30-second answer I need. What is your favorite place to get or be inspired?
That's easy. My exam room. It's why I can't leave my office practice. That's why I still need to be in that place, because the exam room for me is just that place where I get to have people be people. We get all the world shuts down when I close that door, and to sit down in front of somebody and have a conversation with them, try to find a way to make them healthy and well when they're sick, when they're hurting. That's why I tell people medicine is the greatest place to be, because I think that's just a unique, special place. And so that's why I've got to keep my foot in clinical practice.
Excellent. Great answer, my friend. Dr. Hill, great to have you on the show today, and I truly appreciate you taking the time out of your busy schedule and coming, I believe, right from the OR today to join us. So thank you.
I did. Thanks, Justin. I appreciate you having me on.
You got it. And thank everyone for joining us today. And please tune in weekdays, 2:30 p.m. Eastern, 11:30 a.m. Pacific to hear our latest shows. As always, you can track me on Twitter at HIT Advisor and use the hashtag ThisJustinRadio so we can respond to your comments from the show. If you missed any of this episode or want to hear more, all my shows are always posted on Apple iTunes, SoundCloud, iHeartRadio, Spreaker, Google Play, TuneIn, and then also you can check out the new website that we just launched at justinbarnes.com. Thanks, everyone. Have a terrific week.